We know we know that there's quite a bit of experience in the group. Some people are doing evaluation work, may have developed some tools themselves. And so we encourage those of you who want to join in to make this interactive, to join into the chat or use the Q&A option as well. We've timed this in a way we hope that it'll allow for some good discussion and Q&A, but happy to do some interacting throughout the session as well. So with that, I am going to begin with a land acknowledgement, wanting to acknowledge the traditional territories that we're gathering on. In my case, I'm here at McMaster in my office on campus, which is located on the traditional territories of the Mississauga and Haudenosaunee nations within the lands protected by the Dish with One Spoon Wampum Agreement. Ottawa, where I think I should have checked, but I think you're in Ottawa, Maureen. I think I see that background, is built on unceded Anishinaabe-Algonquin territory. The peoples of the Anishinaabe-Algonquin Nation have lived on this territory for millennia, where their culture and presence have nurtured and continue to nurture this land. We honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. We acknowledge those who were here before us, recognize our responsibility as guests to respect and honor the intimate relationship that Indigenous peoples have to this land. And I'll just pause for a couple of moments of reflection. Okay, so Maureen and I thought it was important to do a little bit of introduction. I know some of you may know one or both of us. In my experience, a fairly long career in this field, I've learned that people come from various backgrounds, right? Different training, education, experience, also in different roles. So it's really important if we're going to work together in this space, in the public and patient engagement space, that we actually get to know each other and understand where we're coming from. And this is particularly relevant to this topic of evaluation. So in my case, I have a social science background and specifically in health policy. I have training at the master's and doctoral level in that area, but had a long-standing interest, and this is what's really motivated most of my research career, is an interest in how publics, and I use the term publics plurally, as citizens, taxpayers, service users, and people with lived experience, how we think about how publics in the various forms they take can contribute to and do contribute to and should contribute to health systems and health policy in various ways. So that really has been the focal point for my entire research career. And I have been doing this work for quite some time, for over a couple of decades, as what I like to describe as an observer and an analyst of lots of different trends in this space. And certainly there have been many. And as someone who's been involved for a while, I've seen a lot of really exciting developments, some learning and developments, and also some persistent ongoing challenges in this space. That has certainly inspired and informed some of my work. I obviously do, as an academic, university-based faculty member, do academic research and also service work that focuses on supporting governments, health system organizations, researchers, to help them in the design, implementation, and evaluation work that they do in this space. And formally, I am a member of the Ontario SPORE Support Unit and Ontario Health Teams Central Supports Network, which obviously my focus is on the PE implementation and evaluation side. So now over to you, Maureen.
Thanks, Julia. So I won't bore you with all the details, but like Julia, I've got a little more than 20 years experience in this area, but from a different perspective. I'm actually participating in patient engagement, but I've also been doing a lot of observing too. So it's really interesting to get that perspective of what's changed in the last 20 years. So I come from the rare disease, ultra rare disease actually, community. I have a chronic condition, comorbidities. I'm one of those frequent flyers in the healthcare system, and I've had a lot of experience as a caregiver too. And I've done both patient and citizen engagement. I started about 24 years ago as the first layperson on the Interagency Advisory Panel on Research Ethics. So that was basically where I started, and then it just kind of kept going from there. I'm a teacher at heart, so the topic of evaluation is near and dear to my heart. I really believe in mentorship. and I do a lot of patient and patient partnered research, and both in disease specific rare pediatric diseases and also in methodological research, specifically core outcome sets. So I've seen quite a bit, and I'm really enthused by what I've seen, especially in the last 5 years. And I'll stop there.
Great. And you'll hear more from Maureen and some of her specific research partnerships that she's involved in and through the evaluation lens that we're going to focus on today. So we have three very clear, very straightforward objectives for today. One is to discuss the role of evaluation as a way to support your engagement work, wherever that engagement work resides, whether you're in research, whether you're in the health system side, policy, whether you're engaging with citizens, communities, patients, families, caregivers. We want to talk about the really important role that evaluation can play in supporting all of that work. We plan to provide an overview of different evaluation tools and resources. There are a growing number of them, and we know that people can sometimes be a little bit challenged in terms of figuring out which is the best tool or resource for them in the particular context that they're working in. So we want to help with that and how to think about starting to build evaluation into your engagement work from start to finish. So not as an add-on, which sometimes happens, but actually think about it as early and often as possible. And then to work through examples and applications. And this is where Maureen's going to come in, because she's had some really, really great experience starting to look to apply some of the evaluation tools to her area of interest and one particular research partnership that she's involved in. So that's the plan. Just a few slides to start us off to provide a bit of background. And I think the important kind of message here is, why the call for evaluation? As this subheading indicates, if we're serious about it, we need to be equally serious about evaluating, right? If we're going to do engagement, we need to think about evaluation. Sounds pretty obvious and intuitive. And I thought that was the case when I started into this work over 5 to 8 years ago. But as I started to read the literature and talk to people a little bit, I sensed that there was a little more maybe concern about this or questioning of this, partly because of the concern that, why are we needing to evaluate something that is so incredibly important and really, we have a moral imperative to do. And so there's some interesting literature even that suggests maybe do we really need to do this? So that caused me to think a little bit about this and hear the arguments or the concerns, some of which lie around, there's a moral imperative, or we don't evaluate everything else, so why should we evaluate this? Or as a patient partner, is there going to be more scrutiny on me and what I do compared to other people? What about the other people on the team? So all this is really important to think about when we, make a case for evaluation. And I guess as I've seen, the field evolve, and in my own work, and even in kind of requests to help others think about evaluation, I guess I come to this point, which is, so much of what we do in healthcare is evaluated, quite honestly, and maybe we even aren't evaluating as much as we should be in some areas. I think the point is that for engagement to become really central to everything we do, we need to evaluate. We need to actually be honest with ourselves, look at how we're doing, how well we're doing, try to improve where we can, look at the impacts and the outputs of all of this work. And I think that pressure has come from patient partners themselves, certainly from engagement leads. So that's kind of where I sit in this particular really important question of why evaluate. So maybe others, on the webinar aren't questioning it all, but actually there is some debate about this in the literature. And I'll maybe ask Maureen, do you want to add anything at this point?
Yeah, thanks, Julia. So from my perspective as a patient partner, I support it. For me, it's a moral imperative. So many patient and public partners give so much of themselves while navigating their own healthcare journeys, or as caregivers, or reliving their experiences, which comes at a cost. So I do see it as a moral imperative. Is there an impact? I don't want to find out 10 years from now that I could have been doing something else for the last 20 years, and instead of doing this work. So I think it's really important, and I support it. But as Julia said, it has to be packaged so that it doesn't come off that we're evaluating patients, because actually, I'll talk about Inform Rare, we're actually evaluating ourselves and what we're doing, and and we have to be really clear about that. We really have to be clear about that message so that it doesn't look like we're putting patient partners at a higher standard than everybody else. Thanks, Julia.
Great. Thanks, Maureen. So I think even if we maybe agree or are coming around to the idea of the need for evaluation, that doesn't mean that people aren't coming into this space with very different, ideas about what this should look like. So I kind of the tagline here is different stakeholders, different evaluation goals, and kind of laid out a bit of a heuristic. It's a bit simplified here, but I think depending on who is coming into thinking about evaluation and doing the evaluation work, there may be different questions, there may be different imperatives, there may be different goals, frankly, for what people want to get out of evaluation. So this slide here is designed to show you a little bit of that. So from the practice side of things, these would be engagement practitioners, those working kind of day in, day out in the engagement work in developing and implementing itself, would have questions about, learning and improvement, right? How well are we doing? How can we do better? How do we show the impact of our work? No surprises there. Patient partners, patient family, caregiver partners may have similar questions. They're often part of the practice team as well, but their questions may be a little bit more along the lines of what Maureen said. Are my contributions making a difference? Is this a good use?
Hello, I need help.
Researchers like me are more interested in, what works in what contexts with what outcomes. We're kind of bringing those
not working.
academic questions to this. So a little bit of a different take on this. And then funders or, sponsors of engagement may have a different, slightly different interest, right? Are we achieving our goals? What's the return? We're putting money into engagement. What are we getting out of it? What's the return on investment? And what successes, right, can we point to, right? We often hear about what are our success stories in this space. So how do we start to think about using evaluation to support our engagement work? Kind of three key points here, and kind of they tend to follow along a bit of a trajectory here, right? So early on, you may be wanting to think about goal setting and benchmarking, like even just basic questions, like what are we trying to achieve through our engagement work? Sort of taking stock of what does your engagement work even look like? Can you actually lay it out and describe it, in very concrete terms? Where are we now? Where would we like to be? What are we really thinking about strategically, right, with respect to our engagement work? How do we think about supporting that continuous learning and improvement, the more formative aspects of evaluation on an ongoing basis? How do we make sure that, we've asked, people what their experiences are with the engagement, starting to maybe survey or interview. Maybe it's the, simple starting points initially, and then you get a little more sophisticated. And then, as you tend to spend more time doing your evaluation work and feeling more confident with what you're learning, you may want to start to look at that further out stage of evaluating or assessing the impact of the work and its impacts on a variety of things, whether that be the team itself, their experiences, the knowledge and skills that are being developed, or on the research outputs, themselves. If you're working in a health system space, is it impacts on the services and the programs that are being designed, and how is that engagement work actually shaping and impacting those services and programs? And ultimately on the outputs and outcomes, right? Whether that's, at a service level, clinical, population level. So a host of kind of things to be thinking about as you're starting to get your head around how do we support our engagement work through evaluation. And sort of in terms of very brief summary of where we are with engagement evaluation, I think we have a good handle on measuring those kind of process aspects or experiential aspects of engagement. What was, was it designed well? Was it executed well? Although, different organizations are at different stages even of that more formative work. I think we're going now and starting to fill some gaps, but we're still at an early stage. Is that really challenging work of measuring impact? And that has been more challenging. Even the questions of why do we want to measure impact? Like, I think really important to be thinking about what are we trying to achieve here? So certainly some good developments in this space, lots of interesting kind of reflections and stories and perceived impacts that are being measured and reported on in the literature. But I still think a lack of a lot of very systematic kind of tracing and really thinking very deeply and systematically, as I said, about all the way through from the design of your engagement work, thinking about those goals, How does it roll out to mapping all of those stages along the way to understand how the engagement actually shaped your final outcomes and impacts. And then I also would encourage you, as we're moving through our content, to be thinking creatively, right? And thinking strategically about the different approaches we can use. We often think about surveys and interviews as our go-to sources for evaluation information. I think we can be a lot more creative in thinking about different sources we have within our organizations, within our research groups, documents, minutes, reports. We collect a lot of information in all of our work, and I think we could do more, use those sources of information more strategically to help us with our evaluation work. So we're now going to move into the practical side of the presentation, and I'll just set the scene with a few key questions, right, that we should be thinking about, right, for really being clear and focused and specific in our work. So again, back to the goals. What are we actually trying to do with our evaluation? What aspects of engagement are we evaluating? If we can't be really concrete about what our engagement looks like and how we describe it, how are we possibly going to evaluate it? So being really clear about those goals, and then what does our engagement work look like? And then what are the most appropriate tools for the job? And I'm going to turn now to Maureen and ask her to do a little bit of an overview of Inform Rare, the research group that she's going to be using as an application for thinking about evaluation.
Thank you, Julia. So here is the official name of the CIHR grant and project that became Inform Rare with the principal investigators. Next slide. And basically, we're a Canadian network of more than 65 investigators, including patients and families, healthcare providers, policymakers, ethicists, and methodologists. We're established in 2020. So our goal really is to generate evidence to support decision-making about therapies for rare pediatric diseases. And initially, we're focusing on 3 conditions: mucopolysaccharidosis, or MPS, phenylketonuria, or PKU, and spinal muscular atrophy, or SMA. So that's a little bit about Inform Rare. I encourage you to go to the website. I think it's informrare.ca, all lowercase, very easy to find if you want more information about this network. Next slide. And if you're wondering why researchers should partner with patients, imagine that you're the lucky recipient of this lovely mobile that your parents have so lovingly picked out for you. Next slide. So this just gives you a little bit of context to our project. So we have the research team. Then on the research team, there's a co-PI who co-leads patient engagement. That's me. Then, and I'm from the very beginning of I have an idea stage. Then we have 6 patient partner co-investigators, one of whom, Jan de Fosse, has been very active in this project, is here today. And from the research team, we have Alison Howie, who's here today, and Shelley van der Hoot. So great team. They're all here to support this presentation. And then we also have a parent advisory group, youth advisory group, a youth facilitator, and a special advisor. So we're looking at, more than 25 people, patient partners who we are engaging with. So it's quite a robust patient engagement. It's at the heart and of everything that Inform Rare does is co-design, co-production. Okay, next slide. So we use this multi-layered approach. So that way we can manage to partner with a large group of patient partners and advisors at various levels of engagements. But we're also very flexible. So for example, there's 2 co-investigators who are patient partners who are really at the lead support stage for the registry development. So in that case, I sit back and I just kind of observe, and they do that work. So we have a very flexible approach, but this is really all of the levels of engagement that we work with. Next slide. So
Hello.
as I said, it began at the idea stage, and 7 patient partners are co-investigators, one being a principal investigator, and they were there at the letter of intent stage. They were all involved in the full grant application. And at the beginning of year 2, we added 2 advisory groups, one for youth, with those three conditions, and one for parents of children with those three conditions. And we always say our patient engagement strategy is a work in progress. Next slide. So here's my question to you. If you co-design your patient engagement strategy, doesn't it make sense to co-design your patient engagement evaluation strategy? And more about this in a few minutes. Back over to you, Julia.
Okay, thanks, Maureen. So you've got a bit of an overview of Inform Rare and how the approach to engagement and starting to think about co-design engagement and then co-designing evaluation. If I could just maybe ask the person who's okay, I see a mute on, so I'm just going to ask everyone to just make sure you're muted. So wanted to give you a bit of an overview of the evaluation tools and resources that you may have come across or may come across if you're starting to think about this work. And by no means is this an exhaustive list. There are others. These are ones that have been developed in Canada by Canadians for Canadian health researchers or for the health system folks or health policy people. So I think that's why these four were chosen. They are also three of them are ones that I've been very involved in. But there is a lot out there. There are even toolkits for kind of navigating and looking for others. I think that sometimes people can get overwhelmed. I think we're kind of, as academics, we like to develop things. We like to generate new tools. We're excited about this. We like to think we're contributing. And I know from talking to people on the practice side, sometimes this can be really overwhelming. And so part of the goal today is to help walk you through, navigating what are the differences between these tools? How are they similar? How are they complementary? How could you use them together or maybe, not use them in combination with each other? So in chronological order from the top moving down, the PET, the Public Patient Engagement Evaluation Tool, was released in 2015 and then an updated version released in 2018. This is a tool that I developed with engagement practitioners across the country, again, very much as a call from that community to help with evaluation tools. The PEERS, or Patient Engagement Research Scale, is perhaps one of the first scales to actually help specifically with evaluation in the health research realm. Cleon Hamilton as the lead researcher there out of UBC. The Engagement with Impact Toolkit, again, a tool that I, in collaboration with many others, developed and released just last year, more of a comprehensive toolkit, which you're going to hear more about in a couple of minutes. And then new kid on the block, new framework on the block, which is really exciting to see, is the Evaluation Framework for Patient and Public Engagement and Research, just launched in the last couple of months. Led by Audrey L'Espérance from ENAP in Quebec, and also formerly with CEP, Center for Excellence in Partnership with Patients and Public, and many of you potentially as for support unit folks, for network participants, patient partners, a very, very broad-based collaborative initiative, and a very exciting new piece of work to add to the mix. So we're going to talk now a little bit more deeply about two of the PPEC developed evaluation resources, the PEAT and the Engage with Impact Toolkit. I've given you a little bit of an overview already. Let's go drill a little bit more deeply into the PEAT. As I said, very much developed in response to calls from engagement practitioners who were looking for a simple, easy to use evaluation tool to support their programs. And I've got the word budget in here, and that's important because they actually were coming to me and saying, I need it. I need it to help support, continuous quality improvement in my engagement work. But frankly, I also needed to help prove that my engagement program should remain as a line item in the organization's budget. So there was concern at the time. There was a call for evaluation, for showing the value of your program, and a real need in many organizations for a good, helpful evaluation tool. Structured around principles of quality engagement. So very much around, how do we think about good quality engagement? Is it being achieved, right? So more of a focus on formative or kind of process-oriented measures, not as much focus on impact. Now available in multiple languages, which is really exciting to see around the world, people starting to look at it, pay attention to it, and translate it for their own use. And those translations are all available. And please feel free to to have a look at the PEET on our website. I think you have to download it to actually get to it, but there's a little bit of information about that if you'd like. And I think there's some on the webinar who may have had some experience using it. It is a fairly widely used tool, and has a 3 key elements to it. And essentially these are questionnaires. So it's very simple in its structure. It's simply 3 questionnaires with a bit of a user's guide to help you understand which tool or which questionnaire you may want to use for the particular aspect of your engagement work that you're looking to evaluate. So a participant questionnaire, which is focused on those who are participating in the engagement work, patient partners, maybe staff, anyone involved in the engagement work who you're looking to evaluate, evaluate the efforts that they're involved in. The project questionnaire is focused more at the staff level, so to help them kind of get a sense of how well they're doing with their work. It also helps provide them with a planning tool or a planning rubric for their engagement work. And then really thoughtful contributions from our team who developed this was the organization level questionnaire, which is really aimed at the leadership, actually trying to assess knowledge and perceptions of, how well the organization is doing in terms of carrying out their engagement work. What are the policies and supports in place? What kind of capacity building do they have to actually make sure that engagement is being done properly and there's a commitment to it? And I think that last questionnaire connects nicely to the next piece that I'm going to talk about. So building on the PEET, very helpful for that kind of early stage, very activity specific evaluation, does a nice job of supporting benchmarking, your process evaluation, kind of getting a good sense of where you are at an early stage. But it's has its limits. It's 3 questionnaires. It doesn't tell you what to do, how to do it. It's just 3 questionnaires. So not as helpful for what I would describe as more strategic level evaluation that's going to support more sustained engagement work, along the line of what Maureen is going to be talking about, and how Maureen is approaching it and how Informed Rare is approaching evaluation. So much more bigger picture perspective. Limited support also for measuring and tracing those important engagement impacts. So in contrast, or building on the PEET, the Engage with Impact Toolkit is was really developed to help organizations with that more strategic evaluation. It includes the PEET as well, right, as a key resource, as well as many other resources. So we see it as very complementary to the PEET, but builds on it in a much more strategic way. So very briefly, the toolkit, and please again, feel free to navigate through the website to have a look at it while we're speaking. We're not going to take you onto the website and do a more interactive view of it. We're going to capture some screenshots and talk about it, but please feel free to get onto the site if you'd like. It is, as I said, a very comprehensive menu-driven evaluation resource developed, with a working group of patient partners, engagement leads, and researchers, designed, as I've said, to support all phases of evaluation, to kind of lead you through your evaluation work wherever you are, whether you're at the very beginning, further along, at a more, mature stage. And again, really committed to making sure it's available and in both French and English. And we're pleased to have the paper that describes the development of the toolkit published just in the last couple of weeks. So with that, we're actually going to turn to having a bit of a discussion about the modules. Maureen is now going to kind of take over here and really talk about how she's used the toolkit in her work with Informed Rare. So we have 5 modules comprising the toolkit: planning, tailoring, selecting, collecting, refining. I think, Maureen, you're now going to talk just broadly about how you approach this, because I think there was a lot involved early on in thinking this through.
Thanks, Julia. So I have to say that we built evaluation at the grant application stage, but we hadn't developed a formal plan until we were well on our way, but it was always front of mind. So from the grant application side, we had conducted a monthly audit. I say we, it's mostly Alice and how we conducted a monthly audit of all our patient engagement activities. And we tried at that point to capture as many impacts as possible. We also, at the end of the year, before we developed the strategy, had conducted informal evaluations, just surveys after meetings, a survey experience after the first year with our advisors, and chats with the lead researcher and me. So I suggested the toolkit because I'd been involved in its development, though it was for, originally aimed for Ontario health teams, but I thought that it could be easily adapted to our research network. I also knew that support was available from Julia and her team. So that was very important. So we created a small steering committee composed of the lead researcher Beth Potter, who's attending a faculty meeting today, so can't be here. Shelley Vanderhoot, researcher, our research coordinator, Alison Howie, and me, a patient partner who co-leads the patient engagement. And this is where we spent countless hours completing the modules before actually forming our patient engagement evaluation committee. So it would have been a very, it would have demanded a lot of hours from a committee to do that. And because we're all virtual now, it's not like we could get them all together in a room and, work this out. But I can tell you that the time we spent on completing the modules was very well spent, because I think without completing them, we would have continued evaluating, but without a strategic plan and without the knowledge really of our perspectives on the evaluation, and certainly not a co-design plan that we hope will respond to the needs of everyone in our network. So it was time well spent. It forced us to really think strategically about evaluation. So why are we doing this? Who will benefit? What is feasible? How will we co-create this? And then building a team. So just even the four of us solidified our relationships, and we appreciated all of those different perspectives. So if you start doing this and you look at the modules and you go through all of these exercises that make you think, know that there's a prize at the end. And it's really, for us, like we often think about that now and think, wow, we did a lot of work beforehand, but it's all coming together now.
Great. Thanks for that overview, Maureen. So now what we're going to do is walk you fairly quickly through each of the modules. I'm going to say a couple of words, but Maureen's going to talk about how she worked with each of these modules and integrated it into the Inform Rare evaluation work. So obviously felt self-explanatory. Planning for evaluation, very important. We've talked about the importance of setting goals, of thinking about what your engagement program even looks like, or your strategy and your activities, who's going to be involved in the evaluation, and again, what are those different perspectives that people bring to evaluation. You also may be at a point where you decide maybe we're just not ready to do some of the more kind of sophisticated work around impact measurement. Maybe we can start with something simpler, maybe something more formative to help us just start to do some very basic evaluation work, or maybe you need to do more work on just figuring out where you're at with engagement altogether. Maureen, do you want to add to that?
Yeah, this was probably the toughest models. It really forces you to put your cards on the table and think strategically. So for us, we were looking at a 3-year period. So that helps also to really focus on what is your time period. And we had many discussions as we worked through this module. And as I said, it was quite time consuming, but really like opened the door to actually doing everything else.
So time worth spending up front to yield the rewards down the road.
Yeah, and then we ended up with this committee. And so we sent invitations to all of our patient partners, co-investigators. That's part of our philosophy and the way that if you're a co-investigator, you're invited to everything that Inform Rare does. So we invited them all. We invited all of our youth advisors. Our parent advisors, we chose for the children with MPS, because I'll talk to you a little bit about that later, but for the first year, we focused on a general evaluation, but also a deeper dive into one project where we had already done a lot of engagement. So we got 3 different clinical trial projects going, and they're all at different stages. MPS was the most advanced, so we chose that. We asked the MPS working group clinicians, the researchers affiliated with that project, all of the staff affiliated with MPS and our ethicists. And you can see there, this is what we ended up with. So we're dominated by our patient partners and advisors, but we've got a really good, so we've got a big committee, that's true, but we just did an open invitation to all of those people, and this is what we, I think we're 14, but I'm not sure, I should have checked that before, but we're a pretty big committee. So that's what we ended up with.
Okay, so the second module is more focused on tailoring your evaluation. So you may have developed your plan and you're starting to put the pieces in place. This is the building blocks part of the evaluation work, right? Starting to think about what does our engagement program or kind of strategy look like? What are the activities you're doing? What are the inputs to that engagement work? What actually happens after engagement? What are those outputs? So we in evaluation language, the term logic model is used. It's a very commonly used term and concept in evaluation, in the field of evaluation. So that, and it means just what it says, right? Building logically through your engagement work. And so I'll let Maureen talk about how they use this module.
Yeah, so this one's really important too, because now you've got your vision and you've kind of ironed out a lot of things, but what's really critical now is that that's really just the beginning. So this is really the anchor, your goals and objectives, and the inputs such as the staff, your guiding principles, your budget, your, followed by the activities and methods that you're going to use in your patient engagement, that you already use in your patient evaluation work, which makes you reflect, as you can't evaluate what you don't do. And also the outputs and the short, medium, and long-term impacts. And this generated a lot of discussion at the steering committee meeting. So now we're still at the steering committee, and then we bring this forth, some ideas, some proposals to the committee and get their feedback and rework things. And then we agreed to a timeline that works for everyone. And this is what our timeline looks like. And you can see that we started quite a long time ago, and now we are developing the tools for the evaluation. We've agreed on everything else, and we're going to be conducting the evaluations. We're going to be conducting the evaluation in May of 2023. So that's what our timeline looks like.
So you're getting close to having a lot more information out of your evaluation.
Yeah.
Okay, so we're moving to module 3 now, and this is where, from my perspective, where kind of a lot of the really important foundational elements are, because this is where you're selecting, what are the domains of impact, or what are the areas of impact that I want to focus on, and what are the items, like how am I going to do this? How do I turn? I want to evaluate whether, there's some impact on the priorities of the organization or the decisions that are made, or I want to look at the impact of the engagement and partnering on knowledge and skill building. Okay, I have my domain, but how do I turn that into a measurable, item? So this is what is going on in these slides, and we're going to work through a few of them again, so Maureen can weigh in on which ones they selected and how they worked with them. So this slide is again capturing the key framework that underpins the selecting module. So impact levels and domains. And so on the left, we have the people, programs, organizations, and health systems. So kind of intuitively, you're probably getting a sense of levels, right? At the person level, at the program level, et cetera. So that's kind of thinking about what is that level of impact that you're looking to understand, explore, measure. And then the domains are the area, right? Again, is it knowledge and skills? Is it confidence and trust? Is it about equity? Are our programs more equitable because we actually thought about equity and inclusivity in the design and the engagement work and partnering work that actually went into the design? What about culture change, which is a big one, and one that we spent a lot of time working through. Most people doing this work are looking for some culture change, looking for how do we show that the engagement partnering work has actually affected change throughout the organization. So that's the kind of underlying framework that is available in the selecting module. If you were actually go to the module, you'll see each of the domains is actually listed with a core item that our working group settled on is if you didn't do anything else, if you didn't measure anything else in these domains, you would actually look at this one, and then supplementary items if you wanted to go a little bit further. So I'll stop here and let Maureen, if you wanted to. I don't know if you wanted to comment on the previous slide first.
I did. I just wanted
Okay.
to show how we adapted it. Yeah, so it was pretty simple. If you look on the left-hand side where you've got the four levels. So people is everyone in our network, so that was fine. For program, we selected the specific informed rare research project. So we've got 3 ongoing projects. So it was the specific project. For organization, we selected our informed rare research network, and then we kept health systems. So yeah, so it was pretty easy to adapt. And Julia's going to go through the domains, but we selected 6 out of 8 domains for year 1, though we think they're all relevant. But again, you've got to do what's feasible. Thanks, Julia.
Okay, so these are the first 2 domains: knowledge and skills, confidence and trust. And again, an item for each. So in the case of knowledge and skills, we have a statement here that patient, family, caregiver partners, as a result of this work, they're developing new or improving skills. A supplementary item might be, well, we're also interested in staff, right? Building new knowledge and skills as a result of their involvement. So again, it kind of moves you through, again, what are those core items, and then what are supplementary if you wanted to really focus on this particular domain, what you would look at, and then similarly. And then the letters in the parentheses just relate to those levels, right? So are we talking about people? Are we talking about programs, organizations, or health system? Did you want to comment on this slide, Maureen, or move on?
Yeah, I was going to say that we selected knowledge and skills, and we also added the domain of satisfaction/dissatisfaction, which will be evaluated annually for all members of the network, so patient partners and non-patient partners. And a more specific item, as I said, we're going to do some more deeper dives into one specific project, the MPS project, and that's for year 1.
And is the satisfaction, dissatisfaction, what is that? Is that satisfaction with what, or dissatisfaction with what? Just a kind of a global kind of measure to get a sense of what people are feeling?
Yeah, I can't, the specific items are like with the engagement process, with the, but from everyone's viewpoint, also from the researchers, and how's it working for them. And some people, you have to remember that some people may have never partnered with patients before too, and there's learning on all sides. So yeah, and we had written originally satisfaction, and our committee said, yeah, /dissatisfaction.
Right. And
you don't assume we're satisfied.
Right. And that's a very specific measure that, again, you may use a very simple questionnaire to get at that, an interview. Often questionnaires are good for that sort of thing. If someone's wanting to share something maybe not so positive, maybe do it anonymously in a questionnaire. Okay, great. Right. So again, I'm not going to talk to this slide. And Maureen, if you wanted to comment specifically on how you used any of these domains in your work.
Yes, we selected equity and inclusivity, and we also took priorities and decisions and added accountability to that one. So priorities and decisions and accountability for an annual evaluation. And then we've also built in those specific impacts for the MPS project, where we think we can measure impacts because we've done a lot of work that has the potential to be very, very impactful there. And we were really hoping that, we know that's what's lacking from the evaluations, is those impacts. So we're working really hard with our committee to ask those questions that we need to ask to try to get to the impacts.
Okay,
thanks.
I'm going to move on, if you don't mind, and I'm going to move through our last modules so that we have time for discussion and Q&A. But feel free in that part of it, Maureen, if there's other things you want to add to those other domain areas. So I think hopefully you're getting a bit of a sense of how Maureen has used these modules, and in particular that selecting module to develop kind of the items, right, that they're using in their evaluation work. So as Maureen's getting to this point with Inform Rare, where they're going to have a lot of information, right? You're in the collecting and then soon to be in the analyzing stage, or you may be analyzing a little bit as you go as well. That would be interesting to hear you comment on. Really important to think creatively. I think I commented on this earlier, creatively and strategically. A lot of what I hear a lot from organizations is limited capacity, limited staff time and expertise to do this work. And so you can do a lot pretty efficiently if you really think strategically about when you evaluate, when are you administering your surveys, your interviews, and kind of work efficiently to collect as much information as you can throughout your engagement work. So it isn't always a long survey. It can be very short surveys. Maybe it's something right after a meeting where you just want to pop on and talk to people who were involved and ask a few questions. Again, think out of the box a little bit around the collection approach. And it's not just the survey and the interview. Again, lots of reporting goes on within organizations, their documents, reports, minutes of meetings. Maybe there's something in there that you can use, or maybe there's something you can ask in an email, like a follow-up to a meeting, something quick. So I'll stop there and see if Maureen, you wanted to add to that.
Yeah, I can add very briefly to that. So right now we're at the point of drafting those surveys and interviews and focus group guides to be circulated to the committee for feedback. So one of our goals is not to overwhelm anyone on the team with a lot of evaluations. One of my personal pet peeves is evaluations that ask me questions about things that I never had the power to do. So what we're doing basically is tailoring whatever we're evaluating to the group. Advisors have a certain role, but they don't have that lead, that leading role, and they don't have really decision-making power. So our evaluation is tailored to what the person has agreed to do and has the power to do, and asking those questions and not asking things that just don't make sense. So it's more work because our advisors get a survey, our patient partners get a survey, our researchers get a survey. So, but we're really very aware of not asking questions to things that maybe they didn't sign up to do, or they weren't asked to do. I'll stop there.
Okay. So we're in the refining module now, and this is the last. There are 5 modules. This is the last one, and again, lots going on here. This is, as you're collecting everything, reflecting on your findings, thinking about what are those key findings. Like, there's going to be a lot to take in, but what are the messages you're really getting from your findings? What are the biggest learnings? Who do you want to share this with, and how do you want to share it, right? I think that's an important part of this. Again, that'll differ depending on the type of organization, the group, how big you are, how small, who really needs to get the messages from the evaluation work. So very important stage. Maureen, do you want to comment on that?
Yeah, so we do plan to share our findings with all of our network members as well as beyond. So we're applying for Research Ethics Board approval so that we can use that. And just from the very beginning, we've really focused on listening to our patient partners and advisors in the spirit of continuous learning. And whenever we ask for feedback, whether it be through a project or an evaluation, we report back by creating a what we heard and what we did document, which is on the next page if you take a quick look at it. Yep. That's it for me.
Okay. So we've got that feedback from the survey and chat with advisors, and I think you've got a piece of what we heard and then how we're responding, right? So you're kind of doing this in real time, right? Working on that.
Yes.
Okay. Great. So last couple of slides here, and then I want to stop sharing so we can see people and have a little bit more interaction. Tracking of our PE strategy.
Yeah, that's just an example of how we've been tracking it from day one. So it's a lot of work, but it gives you a really good idea. And the next one is, I didn't talk too much about our youth because we've got a parallel process to engage them. And we're meeting with them this evening again to work out our goals and objectives and so we're doing it a little bit differently, but quite interestingly, there's quite a few synergies between what we've heard from our parent and our adult committee to what we're hearing from the youth. So that's very exciting too, and it's kind of it's interesting. So to hear from them. So for example, when we had the chats last year, only 2 attended the chats. So what worked for the parent advisors did not work for the youth. So we're taking all that into consideration, and we know that it has to be suited to their needs and what's important to them to evaluate. Thanks,
Okay.
Julia.
And then you've got a wish list at the end.
Oh yeah, I can skip this. That's just me saying this is what
right.
I'm hoping
Updating
is
of
coming.
tools, right?
Yeah.
So, and I think what I think this speaks to, though, Maureen, is that the continuous evolution of this, work, right? So I showed you those, resources and tools that have been developed. There's continued work in this space. This is hard work. We don't have all the answers. I know there's some questions about validation and lots of things that we need to work through, but I think let's not just wait for the perfect tool. I think what people are doing is just starting to figure things out, and we have good tools available to us. Think about what is most useful to you in your context for your work. Obviously, reach out to Maureen and I. Maureen is at Maureen chats, so clearly she's interested in chatting, and obviously me and my team, Laura Tripp is someone you could certainly contact. So I'm going to stop sharing there, see if we've got some time for discussion. I'm going to quickly jump into the chat because I haven't been paying attention to it, and see if people have questions, comments, other things they want to add to the discussion.
There are a number of questions, Julia, if you scroll up a little bit.
Okay.
So there's one from Catherine. When using the toolkit, is it encouraged to add or remove domains? And Leslie was wondering, is satisfaction a domain, or does it speak to the domain when Maureen was talking about adding that in?
Yeah, that's partly why I asked for a little follow-up on that, the satisfaction. I think to me, that sounds like it's embedded within, it would be even a question that we'd ask in the PEPE, for example, like our participant questionnaire. We ask that, not a satisfaction question specifically, but along that line. So I think it's embedded in some of the domains. So the question around which domain you choose. We don't, I think part of it's sequential, right? So we kind of, the flow of them, the knowledge and skills, the confidence and trust, if you can kind of look through those 8 domains, they tend to build on each other. But if knowledge and skills, you have to think through what are we most interested in? What is most important to us? What are we focused on? Let's go back to our evaluation goals, and they should help guide you in choosing your domain. So it is not to say at all that you need to include all of the domains. That's a very comprehensive approach to it, but certainly you could pick and choose. And certainly if you're just starting, that would be advisable. One thing we are planning to add to the toolkit, the Engage with Impact Toolkit website, is a few template questionnaires or interview guides. We've been asked that a number of times. Can you give us a bit of a starting point? So we actually plan to do that over the coming months, maybe by the end of spring, hopefully. So have a look out for that. Is domain 2 the most time consuming of the modules? Maureen, what do you think? Is the tailoring the most time consuming, or did you think it was that piece at the beginning in the planning stages?
I think it was the one at the beginning. In the chat, I put what the 2 items that we chose for that satisfaction, dissatisfaction item, domain, because there's a lot of questions about that. So that's what we chose.
Great, thank you.
Okay.
Other questions? Sorry, I'm going backwards in the chat here.
There's one in the Q&A. Did you see that one? Okay.
Oh, about valid.
That's for you, Julia.
The validity, reliability of each, and if you, when you're asking of each, do you mean of PPEC, of Engage with Impact, etc., each of the tools? Certainly peers, I know there's been extensive validity reliability testing. Pete, yes, absolutely. Usability testing in particular. Validity reliability has a very kind of statistical meaning to it, depending on if you're in the measurement space. So I think for each one, I'd probably have to give different types of answers. But if that person wants to follow up with me directly, I can certainly have an offline conversation about that. Thanks for the question, though. It's a good one. So I'm just again reading the Q&A. SPORE doing a similar exercise, much like PAN. Have you worked with other organizations doing similar work? I'm not sure I completely understand the question. Do you mean the Quebec, the work that Audrey L'Espérance and the SPORE Pan-Canadian SPORE initiative has undertaken, that last framework that I presented? Because that sounds like what you're referring to. And certainly there were PAN members involved, Carolyn Canfield, Marianne Levasseur. So I think I was a member of that team as a researcher, but it was a huge, huge team. So looking at your comment, Janice, some people think surveys are patient engagement, some do not. What do you have to say? Maureen, do you want to comment on that? Yeah, I see your eyebrows raised. So.
Yeah, surveys are not patient engagement. No. I think the bar has been set a little bit higher than that. So I would say not. I think that surveys are a good way to capture evaluation of patient engagement. People, especially if you can do them anonymously, or if you just have one person receiving them. Sometimes you can't, but names aren't being shared. It is a good way to capture some of the evaluation, but I don't think it's patient.
You might be thinking about kind of what I just think about as consultation, or even just information gathering. So kind of in the public opinion polling kind of realm, public engagement, where you're just surveying people to gather information. It's not the interactive engagement and very much along the lines of what we're discussing today, but certainly it is a source of can be source of very useful information, right, about what people think about things. But it's quite different.
Laura, Julia, there's a really good question at 118 in the chat from Leslie Norris Singer, which I think you might want to answer, because I'm not sure what she means by, Leslie, I'm not sure what you mean by whether other evaluations still take place as well. So I thought maybe Julia will understand it better than me.
Can I just clarify what I meant?
Please do, Leslie. Yeah, thanks.
Okay, listening to the presentation, it's great. Thank you very much. I'm just wondering, this seems very time consuming. And so I'm wondering from the researcher or the systems or the health systems or whomever else we're including in this, how much work is this going to involve on their part, and how willing will they be to do this? Because do they do their own evaluations on the research itself or on the health system itself? And so are we adding to the burden of evaluation? Because I love the idea of evaluating patient engagement, but in doing so, are we adding to the burden of the other partners involved?
Yeah, so really great comment. Really great and great question in that. So certainly we have heard from patient partners that they sometimes are almost being tasked with evaluation, right? Well, you're doing engagement, you're our partners, can you help us with evaluation? And I certainly would say strongly, have strong concerns about that. I don't think that's the way we're appropriately supporting evaluation, right? This has to come from the organization. This has to come from the leadership. I mean, it can be put forward. I mean, clearly Maureen in Inform Rare said, hey, we need to be evaluating. I think this is important. But there was a kind of organization-wide commitment to this. It can't be the burden can't be placed on the patient partner. So I think that's maybe where you're going with this, and it becomes a whole extra level or layer of work. That's not, you know, at all what I would call for and support. And I think there's recognition that it needs to be spread around and there needs to be capacity. So something we're working on in that realm is to actually help build the capacity for evaluation within, whether it's Ontario health teams, whether it's in research groups, you know, through work like this, to say, here's something that can help you wherever you're at, whatever your capacity you have to kind of do some work without it taking, you know, over and becoming incredibly overwhelming to you. So hopefully that's a useful response. I see we're at time, and I'm going to just do something very quick, which is to just share with you our next webinar, which is coming in a couple of weeks. So 2 weeks from today. If you found this interesting, our next topic will be sharing results from our Pan-Canadian patient partner surveys. This is hearing from patient partners about their experiences in their roles. We'll be talking about future work we're doing out of this study and also some implications for practice and policy. So really appreciate your time and staying with us, and feel free to follow up with my team or with Maureen. And thank you so much, Maureen, for your contributions.
Thank you. Thanks to everyone who attended. Nice to see so many familiar faces.
Bye, everyone. Enjoy the rest of your day. There's an evaluation form for those who are still on. It's going to pop up when you leave. Hopefully you'll be willing. Speaking of evaluation, we want to know how well we did.